Hi, I'm Dr. Ron Kurzeka, author of The Total Parent, and today's topic is head injuries. Head injuries are important because they're actually a significant cause of admission to the hospital and ER visits in young children. The type of head injuries we get concerned about are ones that are associated with either a loss of consciousness, which means blacking out for seconds or minutes, or any type of head injury which is associated with vomiting, confusion, trouble walking, or any change in a child's alertness or mental status. Sometimes a head injury may result in what's called perseveration, which means that the child keeps asking the same questions such as, what happened or why am I here? And they don't recall the answer even though they've been told multiple times. So if your child has any of those symptoms, vomiting, confusion, any trouble walking, any persistent questioning about the same thing over and over again, or any change in their alertness or mental status, they need to be seen by your doctor and emergency physician as soon as possible. The other thing we worry about in children is we use a distance of 2 times their height for a significant fall. So if the child falls, if the child is, let's say, 3 feet tall and they fall from a 6-foot height, that's a significant fall. Although certainly that does not include every case, because some children will only fall maybe 2 or 3 feet, but if their head lands on a hard concrete surface and they hit a critical part of the skull, they may have a skull fracture, bleeding inside the skull, and a blood clot or a hematoma on the brain. In fact, in this CT scan, and this child actually hit his head and he had a significant blood clot on the brain, which is the white area on the side of the brain. So this is called an epidural hematoma, and this child required neurosurgery in order to remove the blood clot which was pressing on the brain. The other thing you need to keep in mind is that if your child has a head injury, you also need to be critically aware of protecting their neck, because any head injury could be associated with a cervical spine injury or a neck injury. So if your child dove in the water and sustained a head injury and possible drowning, you need to also make sure that you control and immobilize their neck when taking them out of the pool and bringing them to the ambulance. So first of all, make sure that you watch a child and that they don't sustain a head injury, which can be due to falls off a table, falls off a chair, falls out of their high chairs. Always make sure that they're strapped in, and keep in mind the things we talked about, the warning signs for a head injury. Again, confusion, change in mental status, any loss of consciousness, or any vomiting. They should be seen by your doctor immediately. Thank you for watching. My name is Dr. Ron Kurzeka.